Yes, Sadgarbhaya. For Rektalakshanamartham, Garbhakritya. So the functional aspect of this Artava is for Garbhakrit. So now we will see what is menstruation. Menstruation is a visible manifestation of a cyclic phenomena or a physiological uterine bleeding. There will be an outshedding of endometrium. Endometrium is the inner, you can see this inner lining of the uterus. That is endometrium. This is myometrium. So the endometrium has mainly two layers. One is the basal layer, stratum basalis, and another is stratum functional layer. So this line close to the myometrium is the basal layer, and this is the functional layer. So this functional layer shed during every month. Okay. After that, from the basal layer, again it regenerates. Okay, this cyclic phenomena is mainly under the control of the hypothalamo pituitary ovarian axis. So, like the menstruation, if you're watching a movie, the movie it's like menstruation is like a movie, and the behind the scene is the director. There will be a script writer. There will be a producer. Like that, they are the hypothalamo pituitary and ovarian axis. So the hormone interplay is the main role for main plays a main role in this cyclic process. So masi masi rajahastrinam rasamsravaditrayam vatsarad yadi panchashatah share. So the menstrual blood contains this. I had already mentioned there is this membrane part. This flows out during menstruation. Okay, there will be dark altered blood, mucus and vaginal epithelium will be there, and there will be fragments of endometrium. And due to this decomposition of blood components, there will be a smell change, or some smell difference will be there. So another most important question is the Shuddha Arthava Lakshana. It may ask for either 2 marks or even for 5 marks. You may get such a question. Shuddha Arthava Lakshana. So if it is for 5 marks, you can start writing from what is Arthava onwards. This portion onwards, you have to write what is Arthava, how it form, when from onset, the duration, like role of Vada. There is a main sloga you had to write is, which explains about the Shuddha Arthava Lakshana. That's in Charaka Chikitsa. Masa Nishpishchadaharti Pancharatranubendicha Nevadibahu Na Atyalpamartam Shuddhavandishe. That we had discussed, no? There should not be any heavy bleeding, there should not be much less bleeding, and also without any burning sensation or without any severe pain. It should occur in every month. And also the color is mentioned. Gunjabala Savarnam. Gunjabala means this Gunjabalam. The color similar to that of Gunjabala Savarnam or Patmalaktaka Sannipam, like that of a red lotus. Color similar to that of a red lotus, or even Indragoba Sangasham. This is the red velvet velvet insect, I think so. Red velvet insect. So the color similar to that of Patmalakta Sannipam or Gunjabala Savarnam or Indragoba Sangashamartham, then only it's considered to be Shuddhartava or a normal menstruation. And certain another reference was also there. Lakshar, the color, similar to that of Laksharasa or Shashasrabam. Shashasrabam means color to that of blood of rabbit. Shashasrabam. Okay. So you had to write this sloga and you can write these terms. Okay. Laksharasobhavam, Shashasrabam. Okay. And also Ishat Krishnam, that is a tint of brownish or blackish color will be there. Vigantha, without any putrefied smell, it is mentioned. Daudam Echa Viranji, it should not stain the cloth. Daudam Echa Viranji, it should not stain the cloth. If it stains, it is considered to be an Artava Tushti, that is considered to be abnormal. Okay. Masanishpashadaharti Panjaratranubendi cha Nevadibahu Natyalpamartam Shuddhamadishet Vunjabala Savarnam cha Patmalaktaka Sannipam Indragopa Sangashamartapam Shuddhamadishit. Now, Rajasrava Kalam is considered as a period of menstruation. Raja means menstruation, Srava means flowing out. So it is considered, the term itself denotes that it is a period of menstruation. We had mentioned that Acharyas have different opinions from 3 days, 5 days, 7 days. So different opinions are mentioned. During this menstruation time, during this Rajasrava Kalam, Vada is the predominant dosha that we had discussed now. Ishat Krishna Vivarnacha Vayu Yonivam. At this time, there will be Vada Pragopa will be there. So that is why certain diets or certain regimens are advised in our classics in order to prevent further Vada Pragopa or which may lead to this Artava Dushti. So the Vada is the main dosha and the Kapha dosha is in Chaya Avastha because during the menstrual time itself, the stratum basalis, that is the basal layer of endometrium, start to proliferate. Okay, start to repair itself. So the Kapha is almost like a anabolic factor. It supports the growth. And in our classics also, certain charyas, that is certain regimens to follow during menstruation, that is mentioned under Rajaswala Charya. So in Rajaswala Charya, it is mentioned that Tatra Pushpekshana Deva Kalyanadaini Trayam Mrija Alangara Rehita Darbha Samstara Shaini Shaireyam Yavagam Stogam Koshta Shodana Karshanam Parne Sharave Haste Vabunjida Brahmacharini. This sloka you had to study. Tatra Pushpa Yakshanadaya. Pushpa, in this term, the Pushpa means menstruation. With the onset of menstruation, Kalyana Daini Trend, that should remind positively. That is, there are so many women having premenstrual symptoms, like there are so many mood fluctuations, like they may have feeling of like crying. So some women may complain of certain craving for certain sweets like that. Some women may have depressive mood. So you should stay positively. Kalyana Daini Trayam for 3 days, and that is mentioned by Ashtanga Hridayana, 3 days. Mrija Alankara Rahitam. She should not wear such garlands or like ornaments like that. It is mentioned. And Darbha Samstara Shani. She should lie on Darbha grass and certain food. And it's also mentioned. Shaireyam, Yavakam, Stogam, Koshta Shodana Karshanam. During that time, the appetite will be somewhat reduced. So light food is advised, and also which does not cause further aggravation of vata. Such type of food is mentioned, and she should eat with parne sharave haste va bunjida. That is also mentioned. I don't know the logic. Parne sharave haste va bunjida. Then she should be observe celibacy, brahmachari. That is, during menstruation, coitus is contraindicated. तत्र पुष्पेक्षणादेव कल्याणदायिनीत्रयं मृज अलङ्काररहिता दर्भसंस्थारशायिनी शैरेयं यावकं स्तोकं कोष्ठशोधनकर्षणं पर्णे शरावे हस्ते वा भुञ्जीत ब्रह्मचारिणी. In Bhavaprakasha, you can see Pashyet Padim Nacha. She should not even see her husband. Like that it is mentioned. So Artha Srava Divise Ahimsa. Ahimsa Brahmacharini. Like she should be like in a calm nature, like that it's mentioned. Ayasam also it's contraindicated. Ayasam, physical exertion, because she's in a bleeding phase. Maybe there is a possibility of getting anemia. So ayasam and exertion should be avoided, and also to prevent heavy flow. Like in older times, we had to concentrate in older times because women had to do so many physical work in even in kitchen and also. So at that time, that is they are advised certain trust for the ladies during the Rajaswala time. That is why some particular particular house like that is constructed near to the house, and there is a resting time for that lady. Ayasam like ayasam, heavy work like bhumikanana, etc. contraindicated. And in Susruta Samhita, we can see some more things are contraindicated like Diva Sopnam, Anjanam, Asrupadanam, Snanam, Anulepanam, Abhyangam, Nakachetana, Pradavana, Hasana, Kadana, like that. There are so many things are contraindicated. Rudo Pradama Divasa, from first day onward, she should observe celibacy, brahmacharini, then she should avoid these things. Divaswapna, Anjana, Astropadana, Snana. Because Snana, I think at that time there may be only common pool like that. Maybe of contamination, maybe it's contraindicated. And Abhyanga, all are exertion. That way it may be contraindicated. And Acharya has also given some explanation why it is contraindicated. Diva Swapnat Andhyaha. If she fall into sleep during a period, then the baby may be baby born to her may be having certain complications like that. It is mentioned. Diva Swapnat Swabashilaha. If lady is putting Anjana during menstruation, then it may cause Andhyam. Like that, so many reasons are also mentioned. So you can write this in your slogan, like in your examination, like Diva, Swapna, Anjana, all are contraindicated according to Susruta Samhita. You can write. You definitely you had to write this sloka, Rajasula Charya, and you had to write this sloka. So for a normal menstruation to occur, can we just pause? Hello, Doctor. Next portion is on menstruation. For a normal menstruation to occur, there should be a coordination of hypothalamo, pituitary, and ovarian axis should be in a coordinated way. And by this hormone, the endometrium, the inner lining of uterus should be responsive to the ovarian hormones. It should respond. And also, for the menstruation to flow out properly, the genital tract should be open. So, in some case, if there is any abnormality or congenital defect in the development, like this vagina is formed from two parts, that is, upper two-third is formed from the Mullerian duct, and the lower portion is formed from the like a tubercle. So, the fusing of these two portion cause the patency of this vagina. If there is any defect in the fusing, or it may lead to a septal defect and it may cause obstruction for the menstruation to flow out. So the patency of genital tract is important for a normal menstrual flow. And also the normal function of thyroid and adrenal gland, they have a supportive role to the hypothalamus pituitary ovarian axis. So from the hypothalamus, gonadotrophic releasing hormone will be released, and it stimulates the pituitary, especially the anterior pituitary, and the anterior pituitary secretes FSH and LH hormone. This is common to both males and females. And if the FSH stimulates the female gonad or ovary, it produces estrogen and progesterone. And in males, it produces testosterone. Okay, this is a basic and outline. Now we'll go into detailing. In HPOSS, we will look for hypothalamus. In the hypothalamus, there are so many group of neurons, so many group of neurons, and this group of neurons are known as nucleus. So we can see this is an arcuate group of nucleus. In the arcuate group of nucleus, this gonadotrophin releasing hormone is secreted. So this gonadotrophin releasing hormone secreted from this arcuate nucleus into the portal system. That is this, you can see the portal system, hypothalamo, you can see the portal system, hypothalamo pituitary portal system. Okay. This hypothalamus has also connection to the higher cortical center. So if there is so many stress, like exam stress or even a death of a nearby relative, which may cause even or you can feel an alteration in the cycles on the regularity of cycles. So the hypothalamus has higher center connections also. and which is also mentioned in our classics also, like Manaso Abhitavat, Shukrasrat Ahara Vihara Doshat, Agala Yoga, Manaso Abhitavat. Manaso, the role of Manas is important and it's mentioned for the normal conception also. So, the GnRH, the gonadotrophin releasing hormone, which is secreted from the hypothalamus, is secreted in a pulsatile fashion. Like it is not at all secreted in a continuous way. For example, if I am giving sweets daily to Dr. Anjana for 1 or 2 hours, she will be hesitated to take it anymore. Like if I'm giving her laddu in every day, she will be happy. Like that, if GnRH is secreted in a pulsatile fashion, then the receptivity of this pituitary will be more. So it may cause upregulation. She will be happy to taking those laddus. Then it will be upregulation. If I am feeding her continuously, she will be hesitant and she will even run away. That's like down regulation. Okay. So the GnRH is secreted from the arcuate nucleus of hypothalamus in a pulsatile fashion, not in a continuous way, just secreting after a break, then again secreting after a break, like that. So there are so many factors also which control this GnRH secretion, like neurotransmitters, neuromodulators, etc. Neurotransmitter like dopamine has a negative effect. That's why in patients with epilepsy who are taking medicine for epilepsy, in that person's this menstruation becomes abnormal, or the cyclic rhythm is lost. This because of they may have some inhibitory or negative effect on this GnRH release, gonadotrophin releasing hormone release, and also this estrogen, which is secreted from the ovary. If estrogen is secreted in a much higher quantity, which may exert a negative effect on GnRH, stop karo, like that it will say. So it also cause a negative and or stopping the release of GnRH. So when the GnRH, gonadotrophin releasing hormone, is secreted from the arcuate nucleus of hypothalamus, it reaches the anterior pituitary or adenohypophysis, AA, anterior pituitary or adenohypophysis. It reaches via the hypothalamo pituitary portal system. This is hypothalamo pituitary portal system. It reaches there in the this area of this pituitary gland is known as pars distalis. This area is pars tuberalis and this is pars distalis area. In this area, there are a beta group of cells. From the beta group of cells, a small oval group of cells is there. They secrete this FSH and LH, gonadotropes, follicular stimulating hormone. So they stimulate the follicular stimulating hormone, like that. So GnRH from the arcuate nucleus secretes when the hypothalamus, GnRH is secreted from the arcuate nucleus. It reaches the anterior pituitary by the hypothalamo pituitary portal system. From there, from the oval group of cells, it secretes FSH and LH. So this FSH and LH start to stimulate the follicles in the ovary. So unlike a male, a female girl born may have the reserve of primordial follicles in her ovary till her menopause. So that primordial follicular reserve will be present in her ovary. At the time of her birth, there will be about 1 to 2 million primordial follicles will be present in her ovary. So these primordial follicles are like in a sleeping state, like in a quiet state. It stopped growing. It is like in a resting phase. Okay, when after puberty, they start to like in between puberty, there is also small development. But after puberty, it occurs in a cyclic procedure. Like these follicles start to develop, and it reaches its maximum size, then becomes Graafian follicle. After that, ovulation occurs, like a cycle occurs. So the FSH hormone has a role in stimulating these follicles. So when the primordial follicles, a group of primordial follicles is recruited to grow. Recruited means from a group, a small amount is selected, like for police recruitment or navy recruitment. From so many 20 to 30-year-old males, a group of male is recruited to navy. Like that, from the ovarian reserve, as an amount of 10 to 20, 12 or 10 to 20 follicles is selected, and this follicles start to grow, but in a slow pace. When this FSH, follicular stimulating hormone from the pituitary, it it start to act, and it make the follicles grow in a steady pace. Like this primordial follicle develops into primary into secondary into tertiary into graphene follicle, like that. Primordial, primary, secondary, tertiary, and graphene follicle. Like that, the follicle grow, and then it goes into ovulation. So if a number of 10 to 12 follicles is selected, but out of this only one follicle reaches into a mature form, like into a graphene follicle. After, when this follicles grow, when it reaches around 5 to 7 days after menstruation, only one follicle is selected as dominant, and it grows on. We will explain detailedly later. So the main function of FSH is to stimulate the follicular growth. Okay, is that clear? Then the first thing the FSH will do is not, it will make the FSH receptors in the follicle. It will make FSH receptor in the follicle, and this is the primordial follicle. You can see there will be an oocyte, and there will be a flattened granulosa cell. This is a basic structure. An oocyte with a flattened granulosa cell. So as the FSH act, these granulosa cells start to develop. These cells surrounding the oocyte start to develop, and the granulosa cells develop, and the size become increased. So when it becomes flattened, the cells become normal or cuboidal, then it is known as primary follicle. And again, this granulosa cells divides rapidly, and there is a space develop. Space develop in between. This space is known as antrum. Okay, this antrum contains so many fluid. So this is known as antral fluid or follicular fluid. So this follicular fluid determines which follicle among the 10 to 15 follicle is selected as a dominant follicle or as a graphene follicle. Like there are so many people. So one person is selected as a class representative, like that, or as a leader. Like that, from there so many follicles, one follicle with maximum good quality is selected as a dominant follicle. So this FSH, if the FSH is not acting upon this follicle, it may go to atresia or programmed cell death. So the FSH selects a group of follicles, and it grows, and it starts to secrete estrogen hormone. From these granulosa cells, this granulosa cell has an important role. This granulosa cells secrete estrogen hormone under the influence of FSH and LH. And outside this is the Theca cells. From the ovarian stroma, Theca cells appears. That is Theca internal and external. They may also have a role in the steroidogenesis. Okay, this Theca cell and this granulosa cell both have an important role in hormone production. So this estrogen is produced from this granulosa cell, and also from with the help of the Theca cells. So next, the LH is the main activity of LH is to after ovulation only, or around the ovulation only. When these follicles grow up to a particular level, when this follicle produces a maximum amount of estrogen, it causes a positive feedback to LH. I am grown to a particular size. Now I need to ovulate. Like that, it sends a message to LH. Then there will be an LH surge will occur. That is, there's an increased secretion of LH hormone, which cause, that is, after the LH surge. LH surge means LH peak. That is maximum amount of LH is secreted. After this peak, within 10 to 12 hours, ovulation will occur. So the main function of ovary is ovulation as well as steroidogenesis, production of estrogen and progesterone hormone. So it is mainly produced from, like, it's a two cell, two gonadotrophin theory. Two cells means like this, we had discussed this granulosa cells, and this is the theca cells. So this granulosa cells and theca cells play a role in the hormone production. So the LH hormone in this theca cells produce androstenedione from cholesterol. You can see from cholesterol, androstenedione is produced with the help of this LH, luteinizing hormone. So cholesterol, or like in our concept, it is from the rasadhatu. Like that, the byproduct is formed. Androstenedione is formed. So this androstenedione is transferred to the granulosa cells. Okay, this androstenedione is transferred to the granulosa cells, and in the granulosa cells, under the influence of the FSH hormone, estradiol is produced. Okay, this is the two cells. That is, two cells means the theca cells and granulosa cells. Two cell, two gonadotrophin. Two gonadotrophin means LH and FSH. So this helps in the production of estradiol or estrogen. Okay, this is the granulosa cells and this is the theca cells. Under the influence of LH, in the theca cells, the androstenedione is produced. The androstenedione is transferred to the granulosa cells. In the granulosa cells, under the influence of FSH, this androstenedione or this androgen is converted to estrogen or estradiol. So the main action of estrogen is the proliferation. Okay, the proliferation of endometrium. That is, during menstruation, the endometrial layer is shut down. The functional layer is shut down. So the main function of estrogen is to promote the regeneration of this endometrium, and also it causes the proliferation of the endometrium. So, and also this during the development of follicle, that is, during the development of primordial follicle, primary, secondary, tertiary Graafian follicle, at this time there will be production of estrogen hormone. So the estrogen hormone act on the uterus at that time. That is, from the first day of menstruation to the 14th day, there will be, especially during the menstruation time, there will be regeneration, and as well as there will be a proliferation of the endometrium occurs. So during the first 14 days in the ovary, there will be development of follicle, there will be development of a dominant follicle, and there will be ovulation. But at the same time, in the uterus, there will be regeneration of the endometrium, and also there will be a proliferation. There will be a new endometriostratal functional layer will be developed. And also, the function of estrogen is to increase the cervical gland secretion. Cervix means the lower portion of uterus. It increases the cervical gland secretion, so that also it favors an atmosphere for the passage or the penetration of sperms. And also it increases the motility of the tube. This is the fallopian tube. This fallopian tube contains so many cilia. Okay, when the ovulation occurs, this fimbriated end is like finger-like end. This fimbriated end pick up the ovum after ovulation. Then this ovum is passed through this area. When a fertilization occurs, this fertilization usually occurs in the ambulatory region, and this developed this fertilized oocyte pass through the tube and it reaches the uterus. So this estrogen supports the motility of the fallopian tube. So if there is reduced, what happens if there will be a reduced motility of this, where there is not any proper motility? So there is more chance of developing an ectopic pregnancy or tubal pregnancy. So the fertilized ovum will not reach the uterus. Sometimes it may implant it here. So there may be result in the ectopic pregnancy or tubal pregnancy. So, and there is progesterone hormone even after the ovulation. So after the ovulation, this graphene follicle become corpus luteum. Okay, this graphene follicle collapsed and it becomes corpus luteum. This corpus luteum produces during the second phase, that is after 14 days, the corpus luteum produces progesterone hormone and also a little bit of estrogen. So the main function of progesterone hormone is to decreases the contraction of myometrium, because every month the uterus is expecting to have a pregnancy. So if the pregnancy occurs by chance, the myometrium should be maximum supporting that pregnancy. So the progesterone hormone has a role into reducing the contractions of the myometrium, and also it increases the tone of the cervix. It increases, like it closes the isthmus, like the lower portion of the uterus. It closes and it supports the pregnancy that much. So the main role of progesterone in the endometrium in the secretory phase is to support the pregnancy, and also it supports by it help or it stimulates the secretion of glycogen from the endometrium to nourish the fertilized ovum. And also in the cervical mucus during the estrogenic phase was like a watery discharge. During the second phase, during the secretory phase, the discharge is turned to a thick discharge, so which prevent the further entry of the sperms.
आपका कोई दोस्त है केएमसी क्या कोई कॉलेज का इस एरिया का कॉलेज का कोई दोस्त है उसके थ्रू मैं टेम्पलेट्स का काम करवा दूंगा
Doctor, can we pause for a second?
जो पोस्टर वगैरह बनते हैं मैं डिजाइन कर दूंगा
We had discussed the hypothalamus pituitary ovarian axis. Now we will learn what is about the menstrual cycle.
नहीं ऐसे मिल गया था थोड़ा
So for easy understanding, we will split the menstrual cycle into endometrial cycle and ovarian cycle. That is, what is happening in the endometrium at this 28 days, and what is happening in the ovary during this 28 days. Like that, we are classifying it for better understanding. So ovarian cycle means the development of follicle. We start from the development of primordial follicle to primary follicle, secondary, tertiary, graphene follicle, ovulation, then the formation of corpus luteum, and by passage of time, this corpus luteum, if pregnancy doesn't happen, this corpus luteum will be degenerated. So in short, this is the event that is happening in the ovary. So better understand, we will split into follicular phase. Follicular phase means up to this much area. That is, the primordial follicle developed to a fully potent graphene follicle. That is the follicular phase. That is the follicular growth phase. Then is the ovulation, the process of ovulation, and after that is a luteal phase. Then after the ovulation up to the next menstruation is considered as luteal phase. So the formation of corpus luteum and its degeneration all includes under luteal phase. So follicular phase, we had already discussed the primordial follicle developed into primary, secondary, and tertiary follicle or antral follicle. And after this antral follicle, one follicle becomes dominant follicle or even graphene follicle. So from the 5th to 7th days of the first day of menstruation, one follicle is selected as dominant follicle. We usually do a follicular study, to assess the growth of the follicle. Especially we do from the 10th day of menstruation. From the 10th day of menstruation, we can observe the growth of follicle. Like when it reaches the 20 millimeter, it usually ruptures. So we can assess the follicular growth by using a follicular study or that is by an ultrasonography. Excuse me, by a transvaginal ultrasonography, you can assess the follicular growth. From the 10th day of menstrual cycle up to ovulation, we can monitor it. And during that time, we can also monitor the endometrial thickness also, because during this follicular growth, there may be secretion of this estrogenic from these follicles, and this estrogen cause the growth and proliferation of the endometrium inside the uterus. So we can also see the endometrium, whether it is an 8 millimeters, the apt endometrial growth. We can see whether it grows to up to 8 millimeters, so that pregnancy will be easily supported. And we will see what is a graphene follicle. We had already discussed this. This is the granulosa cells. This is theca cells, and the innermost theca cell is known as theca interna, and the outermost cells is known as theca externa. This is corona radius. Corona radius. Okay. This when the antrum is formed, a group of granulosa cells surround this oocyte. So this is known as corona radiata. And this is the cumulus oophora. That is a portion of granulosa cells which attaches to the this granulosa cell is known as cumulus oophorus. So when ovulation occurs, there may be thinning of this area, and this oocyte around with this corona radiata escapes out. Okay, this is a follicular antrum. The antrum is a fluid filled space. Okay. When there is a dominant follicle is selected, there is a process of ovulation. When dominant follicle is selected and dominant follicle is having enough estrogen production, and this estrogen production, when there is a sustainable level of estrogen production, it gives a positive feedback to the hypothalamus. Now I have enough estrogen production, and I'm grown to a particular size. Then the next procedure is ovulation. So the next LH will be produced from the pituitary. So let's start to increase 36 hours before the ovulation, and when it reaches its peak, then within 10 to 12 hours, ovulation occurs. This is a laparoscopic image of ovulation. So when the this dominant follicle reaches to the surface of the ovary. Okay, reaches to the surface of the ovary, and the membrane here becomes thinned out, and a plug will form, like a like a stigma plug, like a conical projection. A conical projection will be formed, and this will rupture, and this oocyte along with this corona radiata moves out, along with some follicular fluid. It moves out, and this plug, which again, this the process takes about 1 to 2 minutes only. This process takes, and after that it gets closed. And this movement is also facilitated by this theca muscle. So will be micro muscles in this theca interna and externa. It also causes this movement of the like this, so that it will be expelled out. So after the after ovulation, there will be this graphene follicle will be converted into corpus luteum. So the corpus luteum has an important role in hormone support also. So after the follicles, after the oocyte moves out, then this graphene follicle becomes filled with blood. That is corpus hemorrhagic. After that, there will be a luteinization of the granulosa cells and theca cells by the FSH from the pituitary. Thus, corpus luteum is formed. This corpus luteum secrete progesterone as well as estrogen. But the main hormone during the secretory phase is progesterone, and estrogen is also secreted in a lesser quantity. So, if pregnancy does not happen, almost 3 to 4 days prior to the next menstrual cycle, the corpus luteum start to degenerate, and there will be a fall in the progesterone and estrogen production, which cause the menstruation to happen. And also by side there will be a positive impulse to the GnRH, so that there will be FSH will be secreted, and the FSH will support the follicles for the next month. So during the menstruation itself, the next cycle preparation will also start at simultaneously. Now this is the formation of corpus luteum we had explained. Now it is the endometrial cycle. Endometrial cycle means the cyclic changes which is occurring in the endometrium of the uterus. So during menstruation, under the as the hormone level falls, the endometrial layer, especially the stratum functionalis, becomes shut down. And after that, this again under the influence of estrogen hormone from the follicle, developing follicles, this proliferation occurs, the stratum functional layer becomes more active. And after the ovulation under the influence of this progesterone hormone, in that will be a secretory phase will occur. In the secretory phase, there will be production of glycogen from this endometrium, and the spiral arterioles become more coiled and more blood supply, and the body, especially the endometrium, is fully prepared to receive a fertilized egg. And the menstruation is also known as the weeping of uterus, because every month the body, or every month the uterus is prepared for a fertilized egg. But if fertilization does not happen, then it's known as like a weeping of uterus. Every month this layer is shed out. So in the proliferative phase, we had already discussed, under the influence of FSH hormone from the ovaries, the developing follicles secrete estrogen. Is under the influence of estrogen, this stratum functionalis layer will develop. And the secretory phase, under the influence of mainly progesterone, this changes occurs. So this of course this the endometriotic cycle in side by side, the changes occurring in the ovary and the changes occurring in the uterus. So when the follicle grows, at the time in the uterus there will be menstruation occurs, menstruation started. As the follicle grows, there will be repairing or regeneration of endometrium will be occurs. As the proliferation, as the follicles start to secrete more estrogen, there will be a proliferation of stratum functional layer will occur. And after the ovulation, then there will be secretory changes will be seen in the uterus. So you can see this, there is FSH hormone will be higher during the proliferative phase, and after this there will be a minimal an increase. You can see an increase here in FSH, because FSH also support the ovulation. It also supports the Theca cells to contract, the microfibril contraction also it supports. Then this is the LH surge. The LH surge means the peak LH. After this LH surge, within 10 to 12 hours, their ovulation will occur. Then it regains back into maintains into normal. Again, by the demise of the corpus luteum, the FSH start to increase from the previous cycle itself. For the next preparations of the next cycle, the previous cycle itself, it start to increase a little bit. You can see progesterone is in the peak in the secretory phase of the endometrium, and here also the corpus luteum secrete a minimal amount of estrogen. Now we will move to the Ayurvedic correlation of the menstrual cycle, like it's known as Rutu Chakra. Okay, Rutu Chakra, we can classify this Rutu Chakra into mainly three. Rajasrava Kalam. Rajasrava is the menstruation phase, and Rutukala is the proliferatory as well as in the ovulatory time. We can consider it as a Rutukala, or even it is considered as a fertile period. Ridhavadita Kala is considered to be the secretory phase or the luteal phase. So in the Ridukala, there will be a follicular growth will be there and ovulation will be there in the Ridukala. There is proliferation of the endometrium. So it's mainly a Kaba Pradhana Kala. In Ridhavadita Kala, after the ovulation, it will be in a secretory phase. So the doshas which we had discussed in a Rajasrava Kala only. In Rajasrava Kala, we have seen that the main dosha is the Vada dosha is the Pragobhavastha, and Kaba dosha in the Chaya Avastha. Kaba dosha causes the regeneration of the endometrium. And then in the Rudu Kalam, you can see the Kaba dosha is in the Pragobhavastha because it causes the proliferation. And we can also see there is a Chaya of the Pitta dosha, because for Paga, like for Parinama, for ovulation, like there is a change, no? So the Parinama there will be definitely a role of Pitta dosha will be there. So Pitta will be in Chaya Avastha during the Ridukala or around the time of ovulation. And after ovulation or in the secretory phase, there will be Pitta dosha will be in the Prakopa Avastha and Vada will be in the Chaya Avastha. So Ridukala is also considered as a menstrual cycle. So this will, in a menstrual cycle, the first 5 to 7 days there will be a menstruation. At that time, side by side, there will be a regeneration procedure will also be done by side in the endometrial layer. After that, there will be development of follicle, and this period is the fertile window. That is this period in this which there is a maximum chance of getting pregnant. That is known as fertile window. That is ovulation occurs by around the 14th day. Usually we say that it occurs around by 14th day, but practically we can see in some women it occurs around by 13th day or some women by 15th day also. But in average, like it's a median, it's taken as 14 day. So the ovum has a lifespan of 24 hours only, and sperm has a lifespan of about 72 hours. So if the copulation of if sexual contact occurs in this time around the 12th day also, then also there is a maximum chance of getting pregnant. So this a period is considered to be a fertile window, so that there is a maximum chance of getting pregnant. After that, then the ovum may, if pregnancy will not happen, the ovum may degenerate, and this period is considered to be a non-fertile period or will considered as safe period. So Rudakalam is considered as a fertile window. We can also see some references are there. Rudusu Drishtartave Dwadasharatram Bhavandi. That is from the first day of menstruation up to 12th day is considered as a Rudukalam by Ashtanga Sangraham. Rudustu Drishtartave. That is from the first day of menstruation. Dwadasharatram Bhavandi is considered to be as Rudukalam. But in this cycle, we can see that from the first day of 12th to 12th day, there is only proliferation occurs. There is only proliferation of this endometrium, and the follicular growth only takes place. But ovulation will not take place. But another explanation like Shodasha Mityanye. Ashtanga Sangraha has already mentioned that someone else had told that Ridukala is about 16 days is mentioned. That is in Bhava Prakash has mentioned that Atrav Sava Divasa Ruduhu Shodashratraha. Garbha Grahana Yogyastu Sa Eva Samaya Sudaha. So Ridukalam is the Garbha Grahana Yogi Samaya. Okay. So 16. The explanation by Bhava Prakash is considered to be more apt. So from the first day of menstruation to 16th day, there is a more chance of getting pregnant. Okay. Ajari itself mentioned that during the menstrual phase, during the menstrual time, she should observe celibacy. Like that, Acharya has already mentioned. So, after the menstrual period, up to the 16th day, Acharya has considered the more chance of getting pregnant, which we can easily correlate with the modern also. So this reference from the Bhava seems to be more apt, and you can study the sloka. So Ridukala is considered as the Garbhagrahana Yogya Samaya. So another reference in Asharaka Samhita is mentioned as Purishasya Anubhadrayadasam Striyam cha Apradushta Yoni Shonida Garbhasya Eda Bhavati Samsarge Ridukale. Here also Ridukala is mentioned. That is a male without any deformity but like normal semen analysis, normal semen parameters, and female with normal menstrual cycle, normal garbhasya. If they are having a regular contact in the Rudukala, there is more chance of getting pregnant. So the Rudukala itself in Acharya mentions as a fertile period, as a fertile window period. So during Ritukala, there will be, we had already discussed the role of doshas in Ritukala. The Kabadosha will be in its Pragoba stage. Kabadosha has a role of in a like in a proliferative phase. So Rudumati Lakshana, that is a woman in a Rudumati, in a fertile period, how she looks or like that, Acharya has mentioned. So This second sloka is much easier to learn. You can learn the second sloka. Shama prasanna vadanam surascha shroni payodara sasta akshikukshi pumskamada vidya dhrutumati striya. Certain looks is mentioned, and this her looks become like that if during the proliferative phase there will be more secretion of estrogen. Estrogen has a particular action on the skin and body, so like that a woman may look more beautiful or more looking more glowing during her this fertile window period, especially it is due to the action of estrogen. Like that Acharya has observed and mentioned like that Shama Prasanna Vadana Svirastra Shroni Payodara Sasta Akshi Pums Kamada. She become more romantic at that time. Such type of woman is mentioned to be Rudumadi Stri. So woman during this fertile window period looks more beautiful, and she is having more of a sexual drive, like that Acharya has mentioned. Another Rudumati Charya. What are things that a lady had to do after her Rajasrava Kalam, after her menstruation, Chaturthya, because Ashtangridaya is mentioned, because Ashtangridaya 3 days is mentioned as a normal menstrual period. So on the fourth day, she had to take a bath. Like previously, bath was contraindicated during menstruation. So after 4 days, she had to take a bath. She can now wear a shukla vasam. She can wear a white dress, and she is considered to be pure. Like that, it is mentioned. So yeah, you may get questions from Rudumati also. So if a question comes about Ridukala, you can explain this Ridukala was a fertile window. You can add the sloka, Artavasrava Divasat, and also you can mention the Rudumati Lakshana is mentioned in our classic, and you can add the sloka, Shama Prasanavadana, that sloka you can include. And Acharya has also mentioned Rudumati Charya for the ladies after menstruation, that also you can add. Sudhavadita Kala, that is Rajastava Kalam we had mentioned, that is the period during menstruation. Ridumati Kalam, that is during the fertile period. And after that, that is the secretory phase or the luteal phase is considered to be the Ridavadita Kalam. That is, here the ovulation has occurred, and or even if pregnancy doesn't happen, the ovum has already degenerated. So there is no chance of getting pregnant. So Acharya has mentioned that Patmam Sangojedi Dine Adide Yada Tada Hridavadide Yoni Sa Shukram Na Adaha Pradichidi. That is, at the end of the day, the lotus like fold backs when the sun sets. So only the next day, only the lotus reopens. Like that, the lotus had closed. That means the cervix or the cervical mucus had already changed. That is, there is a less chance of getting pregnant and a less favorable atmosphere for the sperm to pass. Like that, Acharya has mentioned that is there is a less chance of getting pregnant in Rudavadita Kala. Doctor, can you please pause? This is concept of Sri Shukra. Sometimes you may get a question from this area also. This you had to understand the basics. So, Sri Shukra, the concept of Sri Shukra is mentioned in some context. It is mentioned as like a secretion. We can take the concept of Sri Shukra in two contexts. One as a Bartholin's gland secretion, and also one as a Shukra as a Dhatu. Okay, first we will explain the as a Sri Shukra as a secretion from the Bartholin gland secretion only. In Bhava Prakash and also Nashtanga Sagraha, it is mentioned that Yo Yoshido Abhi Savatyeva Shukram Pumsaha Samagame Garbhasya Tat Na Kinjit. That is, even during the sexual act, the woman to have secretions from the her vagina. This is considered to be as Sri Shukra, but it doesn't have any role in the formation of Garbha. That is, it is considered to be the secretion from the Bartholin gland. Bartholin gland is situated in the near the vaginal opening, that is in the vestibule of the vulva. It is situated there. It is there will be secretions from the Bartholin gland during the sexual act. it is considered to be as 3 Shukra in one concept. In another concept, 3 Shukra is considered as a Shukra Dhatu only because Dosha Dhatu Mala Muloshi Deham, there is Dhatu, Shukra Dhatu is also present in Stri also. According to Bhava Prakash, has considered that there will be 8 Dhadus in Stri. So Artava is considered as a 7 Dhatu. Then only Acharya, there also Acharya has mentioned Shukra Dhatu as seen in ladies or in Stri. So here we can consider the Dhatu, Shukra as a Dhatu in Stri also. This Shukra is present in the Shukradhara Kala, which is present in the whole body, which is responsible for the formation of even like the hormones in the HPA axis. We can consider it as a Shukradhatu. These Shukradhatu is responsible for even for the development of secondary sexual characters and the development of the like uterus, etc. This Shukradhatu plays a major role. So we can consider the hormones behind the HPO axis as the Shukradhatu in female. So there are two concepts. One is that as secretion from the Bartholin gland, and second is as Shukradhatu. So here we can see we cannot consider this Shukradhatu as an Artava because we had already mentioned that Artava is an Ubadhatu of Artava is an Ubadhatu of Rasadhatu only. Right? Artava is an Ubadhatu of Rasadhatu only. As there is formation of Shukra, you can see there will be Bahya Shukra and Andar Shukra. Bahya Shukra you can consider it as the semen in male and also as the secretions from the Bartholin glands in female. In Andar Shukra, you can consider both the hormonal changes that occur in both males and females as Andar Shukra. Like the even the development of secondary sexual characters, like the development of follicles, all are considered as this Andar Shukra. Next is Artavaha Srodhas. This also you can get as a question, explain the concept of Artavaha Srodhas. In this context also you had to learn this sloka. Artavahe dve tayor moolam garbhashyam artavahinya damanyah tad viddaya vanditam maidunasahishnitam artavanashascha. Artavahe dve tayor moolam garbhashyam artavahinya damanyah tad viddaya vanditam maidunasahishnitam artavanashascha. So the Moolasthana of this Artava Damani is Gashya. You can consider this Artava Damanis as you can also consider it as fallopian tube also. Because you can also the Artava in some context Artava Bija is considered as Artava or the ovum is also considered as Artava or considered as Artava. So if there is any obstructions in the fallopian tube or if we are doing a postpartum sterilization like that if there is obstructions or doing a like post like rupturing or like suturing the fallopian tube then there will be a chance of pandita or it may cause infertility. And you can also consider this hormone as a artavaha this srodhas also because even the absence of this hormones then also there will be this Maiduna Sashnata. Maiduna Sashnata means the vagina has a very much it is sensitive to estrogen. So the normal vaginal secretion is under the influence of this estrogen hormone. So if there is a no proper formation of this proper functioning of this HPO axis, then there will be less development of less formation of this vaginal secretion, which also lead to Maiduna Sashnata or even Artavanasha like that. You can also write this and two concepts. One as a Arthavastrothas as fallopian tube you can write and another as a hormones from the hypothalamus pituitary ovarian axis. You can also consider it as an Arthavastrothas. Next is the last topic is puberty and menarche. So puberty is a link between childhood and adulthood. In this puberty, there is a gradual maturation of this hypothalamus pituitary ovarian axis. Like if a child is like first the baby will crawl, then the baby will try to stand, then it will run only. Like that, the HPO axis had to work in coordination, then only it will uh, work in a proper manner. So there is this coordination and maturation takes place during this puberty period, and there will be so many morphological changes happens in the body, like breast budding, development of pubic and axillary hair, like increase in growth, like so many changes are taking place, development of secondary sexual characters and menarche. And even after that, or then even after menarche also, there will be development, or there will be attainment of maturity of these reproductive structures. So these changes are taking place in the puberty period. In the puberty, these changes start from the 8 years onwards. 8 to 12 years it start, because there will be a gradual increase in the height, and breastfeeding usually takes place from about 9 to 10 years. Usually, now it happens in young girls. So there will be telarche, means development of breastfeeding or breastfeeding. This is telarche. Adrenarche means development of body hair, especially this like pubic and axillary hair. This that is that by the influence of the adrenal androgen. This adrenarche occurs. T like this breastfeeding is mainly occur under the influence of ovarian estrogen only. Breastfeeding occurs, and gradually there will be an increase in the height, and then menarche will occur. Balatu giyade nari yavat varshani shodasha. By 16 years after attaining the reproductive maturity, a girl is considered to be as a woman, like that. Balatu giyade nari yavat varshani shodasha. So there are so many factors which contribute to the onset of puberty. The first and foremost factor is the genetic factor. So if a girl's mother occurred puberty by around the 12 to 13 years, then there will be more chance of that girl to occur menarche at that time. Okay. And certain nutritional factors also. Nowadays, we can see more girls attain menarche by the age of 10 or 11 years, because of the more intake of nutritious food, especially hormone food like chicken and all those things. You can see now the puberty has uh, menarche has occurring somewhat early ages, like 10, 11 years. And body fat, physiological, psychological state, exposure to light, especially long nightlife, there may be a more chance of getting menarche early. Like that, there are so many factors which contribute to the onset of puberty. In our class 6 also, Acharya had mentioned that षोडशवर्षयोर्हि शोणितशुक्रयोर्मध्ये अर्वागमहि यत आहारविहारविशेषात् आरोग्याच्च पूर्वे भवतः. So if a girl is having a good nutrition supplement, then there will be a more chance of developing menarche earlier. Arvagavati ahara visheshat arogya we can also consider as genetic factor. Arogyacha purve bodha. And also, while explaining about the menopause, Acharya has mentioned that Kritak Shira Nityasu Udasu Kabatmasu, in Kabak Prakriti ladies, and also his habit of taking Krita and Shira more, then there that ladies the artha may last for a long time. Like that, if a young girl is habited to this, she may attain earlier menarche. Like that, the concept is mentioned. So in modern, we can see that the increased body fat may cause there is a role of leptin produced from the body fat, which has an important role in the menarche. And also, if a woman is having serious exercise, they are having more physical activities, they are having less body fat, then there will be a chance to of delayed menarche, delayed puberty. So the factors which stimulate the onset of puberty are like leptin, neuropeptide by GPRS4 gene. GPRS, no, GPRS, like GPRS, GPRS4 gene, neuropeptide by and leptin plays a major role in the onset of puberty. Adding to it is the genetic, nutritional, body fat, psychological state, and exposure to light, which is well explained in our classics also. You can write this sloga. Shodashavarshyorhi. That sloga is very important. You can write it in the puberty context. So when even before the even before this puberty period, or even during the 6 to 8 period age, then also there will be the body is having the GnRH and estrogen in low amount. But at that time, there will be the GnRH, the negative feedback of GnRH is very much sensitive. Even a small amount of estrogen is present in the body, it may cause a negative feedback to the hypothalamus. As age advances, this negative feedback also reduces, and there will be a gradually production of estrogen hormone. But this estrogen hormone is not capable of producing menstruation. But the ovarian estrogen is capable of developing secondary sexual characters, like this development of breast budding. Like that, changes are occur simultaneously in the body. And we can see there will be an accelerated growth is seen in young girls, especially with the 10 years of age. And there are growth started. There are accelerated growth started. And after that, within 10 years, you can see the breast budding start to happen. And later, pubic and axillary hair develops. And after that, only menarche will occur. So if breast budding is, if we notice breast budding, then within 2 to 2.5 years, menarche will occur. That is a normal course of breastfeeding. Even after breastfeeding, it takes almost another 3 to 4 years for the complete development, like of an adult breast. So accelerated growth in girls is normally due to the action. Definitely, it will be action of growth hormone, and also insulin like growth factors also support, and also estrogen also support for this growth, increase the growth in girl child. TLRK, which is the noticeable first sign of puberty, like breastfeeding. It takes usually about within 9 to 10, or nowadays it is usually seen in 9 to 10 years. And even after breastfeeding, it takes almost another 4.5 years for the breast to develop properly into an adult breast. And the correlation we can see is രജസി ചോപചീയമാണ് ശനൈഹി ശനൈഹി സ്ഥാനം ഗർഭാശയ uribum. So after this, Rajas, the development of Rajas, which helps in the development of breast and uterus also. Uterus, yoni, every portion, every reproductive structure start to develop by the action of the Rajas. Next is adrenarche. Adrenarche means with the help of the adrenal androgen, like sexual hairs in the axilla and pubic region, they start to develop. Especially the adrenal androstenedione has a particular role in it. A correlation is seen. Vaya parinama Romarajyadesha Visheshena Narinam. Romaraji, that is development of hair develops. But in its commentary, it is mentioned that Adi Shabda includes everything, that Sanya, Artava, all the secondary sexual characters are included under the Romaraji. So another, there is a classification. There's a classification tanners, like tanner staging is mentioned for they observe the development of breastfeeding typical hair. In order we can classify whether these growth are normal or whether they are growing like a normal rhythm. Like that, with the help of tanner staging, we can classify. So menarche is also the late pubertal event when the GnRH is increases and it stimulates the ovary, and this ovary produces estrogen, which causes the proliferation of endometrium. At this time, even without ovulation, there will be a proliferation of endometrium. And when this endometrial lining outgrows, and after that, even a sudden dip of this estrogen level cause this this menstruation, or it start the menarche, like there will be shedding, but it takes almost 1.5 hour, 1.5 year or 2 years to become this menstruation to become cyclic or with ovulatory. Then only the ovulatory cycle will occur. So another nowadays we can see ladies not young girl may have precocious puberty. Precocious puberty means there is onset of secondary sexual characters before the age of 8 years, or menarche before the age of 10 years. Yesterday also I got a call from a A mother, she's from outside India. She's having her baby is having her not baby, her lady, her girl child is having menstruation. Menarche, she's only 9 years old. She is somewhat obese and she's very much interested in KFC. Like that, the nutritional factor plays a major role. Okay, this is precocious puberty, maybe due to the excess estrogen production or excess androgen production. And also this can be either it can be a constitutional or it can be due to the nutritional factor or even it can be due to the premature activation of this HPA axis. And there's also there will be some pathological condition also. Some granulosa cell tumor, theca cell tumor, adrenal hyperplasia may also contribute to precocious puberty. Even at the age of 4 to 5 years, we can also see girls with menarche. Okay. So delayed menarche means breast tissue development will be delayed or pubic hair development will be delayed even after 13 or 14 years. There will be delayed menstruation or menarche will not occur after before the age of 16 years. So this is considered to be delayed menarche. But nowadays delayed menarche there are very less cases only. There may be a chance of either it may be a constitutional delay whether her mother or her family where a grandmother or may have this delayed menarche, or it can be due to ovarian failure or gonadal dysgenesis, or even malnutrition may be a cause for delayed menarche. So, thank you for your patient listening. Is there any doubt?
No, ma'am.
Thank you, Asmita.
Thank
Akshata?
you, ma'am.
Okay.
Yes, ma'am.
Akshata,
I have a doubt, ma'am.
yes.
Ma'am,
Akshata?
in case of when we give ovulation induction, it is given on
Mm,
the second day of the menstrual
mm,
cycle. Why it is
mm.
given on second day, ma'am?
Second day is not given in ovulation induction. Hello, Akshata?
Yes, ma'am.
We are not giving menstruation in modern, no?
Yes, ma'am.
GNRH, yeah, for GNRH, there may be given, but in Ayurvedic concept, we don't give for ovulation induction. Okay.
Yes. And ma'am, one more question.
Mm.
Ma'am, how to confirm whether it is a annular bleeding?
Anovula bleeding
Yes,
in a puberty or in a menarche subject or in any ladies.
in any bleeding.
Okay. If there is occurring in if there is cyclic bleeding is there, and if she is having a mild to moderate pain is there, then we can consider it may be ovular cycles only. If the lady is complaining with heavy bleeding, her cycles is irregular, then there may be a more chance of anovula bleeding will be there, especially in PCOS patient, etc. So you can confirm it by doing a follicular study also. You can do a follicular study from day 10 onwards, then you can confirm it is an ovulatory or anovulatory cycle. Usually, you can see anovula cycles after the age of menarche. Within 2 to 3 years, you can see young girls complaining with anovula cycle with heavy bleeding and irregular cycles. Usually, regular cycles with moderate bleeding is considered to be an ovulatory only. Is it clear, Akshita?
Okay. Yes, ma'am. Thank you, ma'am.
Okay.
Hope all the queries are over. Dr. Divya, shall we
Dr.
wind up?
Anjana, is there any question? Yeah, sure.
I think everything is over.
If there is any doubt, you can ask in the next class. And also, if this recorded section is available, you please listen the sloga portion. Especially this is the basic portion. You please try to listen it once more and try to learn sloga. If you have any doubt, you can ask me in the next class. Okay.
Thank you, Dr. Divya. Thank you so much.
Okay.
पागल कर देता है, डर लगने लगता है।
तभी लग रहा है तो ऐसा हो गया मेरा देखने में
आपके में पहले ऐसा था, अब ऐसा हो गया। आप फिर बाप कलेजा रख कर
जब ये मूवी स्टार्टिंग में आया था मुझे क्या बोला भैया आप तो बनाओगे मूवी बोल तो बहुत मैंने बोला कि तो मोटिवेट कर दिया मेरे को बहुत तगड़ा
पत्नी को भी कमाने लगवा दी साला, शादी करके देंगी, चल जा पैसे कमा के ला, नहीं भी तो देंगे।
नहीं खा पाऊंगा मैं भी भूख नहीं है लेकिन मैं खा लेता
बच्चा पैदा होगा ना, अगले दिन को चाय का दुकान पे लगा दी। 1 महीने का होगा भाई। तेरे जब जाएगा ना तेरे बगल में पैसा का पेटी रखूंगा, उसका तेरे यमराज को भी पैसा कमा लो। आए थे नंगे जाओगे नंगे, ध्यान रखना, पैसा लेके नहीं जाओगे, उतना ही कमाओ जितना हो पाए।
भगवान ये तो बना के देंगे। तो कुछ जब चाहता ना समझा और लोग हाय हाय करता समझा।
ये विलेज में है तो आदमी मुझे ऐसे ही सब सुना होगा जब वो मरा था तो उसने बताया था कि गड्ढे में मेरा गाड़ी मतलब वो उसका सब पैसा सब कुछ गड़वाया था गड्ढे में सबका फेवरेट गाड़ी था वो भी उसके अंदर था बेड पे लेटा आके छोड़ रखा था उसको रूम बना रखा था पूरा और वो फोटो वीडियो अपने लेके हुआ था
ऐसा कहीं ना हुआ आपका।
क्या बात है सीरियस बात है
नील अंबानी को भी पीछे छोड़ेगा, इतना सोच के कमा दिया उसका। क्या दया भाभी के भाई।
जितना की जितना देखा तुमने हैं ऐसा पूरे
गिर जाएगा दूध।
मुझे फिर मूवी से शौक बहुत था मुझे अपने पापा
दीपू नाम क्यों रखा?
देन
तेरा?
मुझे नाम है ना
इसका नाम दीपू क्यों रखा? मामी चाय की दुकान पे गई हुई थी क्या? दीपू चाय वाले का नाम। और मामा चाय पी रहे थे। मैं तो बहुत हंस रहा है। देखना लो भैया, एक दवाई दे दो बस, कुछ हो जाएगा भैया, भूत ऐसा। आप ही को पकड़ूंगा ना भूत बन के, दे दो भैया।
या मन लग रहा है नहीं मन लग रहा तो बताता है।
बहुत
फिर से बोलिए मन लग रहा है आपको।
गोरी चिट्ठी देखने को मिल रही है, मलकागंज में जाता हूँ मैं, घूरता हूँ। हंसते हंसते खर्राटे ही लेता है दूसरा। व्रत रखता था यहाँ आने के लिए, 1 मिनट के लिए। मैं बस 20 सेकंड का व्रत रखता हूँ।
कुछ लगा तो लगाऊंगा ना जरूर 2 घंटे का खाना खा लेता ये लोगों से बात सुन रहा था ना दिखता ना कोई हाँ तगड़ा बंदा लग रहा है मोटी है सामने
मैं बात कर लूँ समझा। सबसे बात की
यहाँ देखता ना यहाँ पे कोई बंदा ऐसा दिख रहा है कमाने वाला उसको ले आते हैं अपने ऑफिस में रखते हैं
उसको तो मन फेर देगा फिर पता नहीं पता है कि हाँ लगा कर लो अच्छा। गेट लगाओ गेट लगाओ।